What I learned in that journey was never judge someone else. I learned to accept people for where they were and who they were, and to help them in that journey.
Today's guest is Cal Beyer, a pioneer in workplace well-being, safety, and leadership. For more than 30 years, he has been at the forefront of reshaping how industries approach mental health and human connection.
You worked in some high-impact spaces, from workplace mental health to addiction recovery. How did this journey begin for you personally?
I came from a family that experienced chronic pain, and in that journey, I learned coping strategy of hitting a pill bottle. And what I learned in that journey was never judge someone else. That's how that journey began.
This podcast is about leadership, mental health, and creating workplaces where people feel valued and thrive.
I made a commitment that no matter what career I chose, it was going to be focused on saving lives.
Hey everyone, welcome to the show. Today I have Senior Director of Safe Workplaces, which SAFE stands for Stop the Addiction Fatality Epidemic. Cal, welcome to the show.
Samak, thank you so much. Look forward to our conversation today. Great to see you.
Excellent. Cal, you worked in some high-impact spaces, from workplace mental health to addiction recovery. How did this journey begin for you personally? Tell me more.
Thank you for amplifying this voice and this message. I came from a family that experienced chronic pain, and in that journey, I learned coping strategy of hitting a pill bottle. I had 3 knee operations between the ages of 12 and 14. I have lived experience with prescription pain medication use, misuse, and abuse. It started innocently when I had emotional pain after the surgery, when I wasn't able to play sports. And what I learned in that journey was never judge someone else. I learned to accept people for where they were and who they were, and to help them in that journey. So I decided not to pursue a career in healthcare. I'd worked in healthcare through high school and college, but I learned that I experienced traumatic experiences working in an emergency room, in an ICU, and an organ transplant unit. So I chose that not as a career, but I made a commitment that no matter what career I chose, it was going to be focused on saving lives. So I became a risk management professional and a safety professional. And over time, I learned how to approach wellness as well. That's how that journey began.
Excellent. And you mentioned SAFE Project. What is its core mission, and why does it matter so deeply to you?
Yeah, SAFE Project is a powerful nonprofit. It's existed since 2017. I met them about 4 years ago. And whenever I was doing work in workplace mental health, specifically in the construction and manufacturing industries, I would bring the CEO, who then became a friend, and then we became collaborators. And then I recognized this really is the next chapter in my work on workplace mental health. SAFE Project exists to address tangibly the overdose epidemic. In the United States, it focused heavily on the opioid crisis. We have about 5% of the population. We had about 80 to 85% of the opioids. So that was one tangible area. But Samak, what I've learned is we needed to do more on the alcohol and tobacco and other non-substance addiction that sucks life and joy out of many individuals. And a lot of families don't know how to address this issue that is the elephant in the room at home and in the workplace.
Yes. Why do you think so many men in high-pressure industries struggle to admit they need help?
What got us to where we're at was not talking about our feelings, just sucking it up and getting the work done. So I'd spent the first 8 years in my career working in public entities. What we learned was we needed to talk about. It's how we broke down stigma. It's how we supported one another. When I moved to construction in 1995, no one talked about emotions. It took me almost 10 years to get this idea of critical incident response to address the emotional needs of employees after a traumatic experience. I was fortunate. I had an incredible mentor post 9/11.
Right.
And if we could get people on the same team wearing the same jersey to help people, it took away the barriers. And
Got it.
it's been very successful.
Now, what's the kind of mindset change you've seen in the whole space?
We have a long way to go. We've made real progress. When I look back, in 2010, I was appointed to the National Action Alliance for Suicide Prevention. It was a newly formed group in the United States. and it is the nation's public-private partnership. We have over 250 different partner organizations. I was appointed to the executive committee in 2016, but since 2012, I started a construction subcommittee. It took me 6 months to get my first volunteer. And I had to beg someone, if you do this, I promise I'll never bug you again in your career. But if you do this for me, I know I can build momentum. That was very challenging beginning. But by 2014, I decided I needed to leave the insurance industry where I'd been as executive and go work for a construction company to show people how to build this into the culture. And so, Mac, I got further in the first 4 months than I had in the prior 8 years. And sometimes I take my glasses off and then say it could have been a V8. Like, that's all it took was to go be one, because people recognized what I was saying was true, even before there was data demonstrating that our industry had an issue with mental health, anxiety, depression, and suicide. And then fast forward a few years, we recognized all the musculoskeletal injuries and the overprescribing in the United States of opioids brought a lot of pain to a lot of families for medical, dental, and surgical procedures. And we knew we needed to do more. So when I look to see how far we've come a long way, but we're still not reaching enough of the small and medium-sized businesses. We've been carried by the efforts of larger organizations. We won't be successful until this reaches every job site and every organization is willing to take that risk to have the tough conversations and provide tools and resources to their employees.
That's an interesting point, right? So what is needed at the SMB level to get the awareness out there rather than the larger corporations?
We need leadership support. We need visible, vocal, and vulnerable leaders. I call it the 3 Vs. If we have vocal and visible leadership support to acknowledge it's okay to not be okay, and if a leader or someone in their leadership team is willing to be vulnerable, to share their story of how they've been impacted, how their family struggles, how they've sought support, how they've received support, it opens things up for people to realize it's safe to talk about. So this idea we talk about in leadership circles, a psychological safety, that you're part of a team and you can speak out, you can ask for help, you're not afraid of making mistakes. Psychological safety is really foundational to addressing psychosocial risk factors in the workplace. So what small and medium businesses need to recognize is our workers are at risk and their families are at risk. And we can be a safety net. If we talk about it, we can break down stigma. We can get people access to care.
Got it.
It's a mindset shift.
It's a mindset shift. And maybe it's a different language they need to speak, right? The impact of the bottom line or the top line at the end of the day, right? If employees are not coming to work, guess what? Your business is going to suffer. It could be as simple as that.
Early in my career, it was around 2000, probably 1998, I attended a conference, and the group is called the Construction Financial Management Association. About 100 chapters in the US and in Canada. And I attended that conference and I recognized, wow, I have an opportunity to develop a voice, to reach people, to help them understand this idea of caring cultures. I made a decision in the insurance industry. I was going to specialize on human capital risk management. And no one really talked about it that way. But I started teaching companies how to invest in workforce development, how to build those caring cultures, and how to have the tough conversations. And lo and behold, when it was time to launch this initiative in the United States, we went to the Construction Financial Management Association, and they said yes. And they said, Cal, because you've set us up on this discussion of human capital risk management, we know how important this is. So that was a turning point. And it really showed me that 15 years at that point, investing in human capital risk management would make a big difference.
Excellent. And, what does colluding with the problem look like in a business setting, and how can leaders break this pattern?
Yes, I think it's being willing to be a change agent. Unfortunately, when you are adapting to changing business needs, it's easy to get confused. I was able to stay laser focused and still take care of my day job. But I did this in early mornings and late nights. I became kind of a skunk works of types to say, what can I do? Doing my day job is a learning laboratory for me to apply things, but how can I bring this for the greater good? And really what I recognized was if I was going to tackle this problem, I had to get more people involved. So I was deliberate. I started a media saturation campaign. I felt initially it might be the only thing I could do was to get people talking about it. Number two, I got association leaders involved. And if I could get them to talk about this at their conferences, write about it in their newsletters, then I could get more people involved. I went to unions and said union participation because they had critical mass in certain big cities and big high-risk industries. And the fourth strategy was build an army of helpers. I was very open to just sharing resources, materials, holding training classes to teach people how to have these conversations. And then the fifth was go take it into hard to reach work environments. So I identified over 50 different trades and segments where I was the icebreaker. Those 5 strategies served this well. And now today I see the fruits of those efforts by so many initiatives, so many spin-offs. In 2016, we started a group called the Construction Industry Alliance for Suicide Prevention. And today there's so many organizations driving change, reaching people and stakeholders in their sectors and segments and trades. It's been powerful.
Wow. Can you share a story which was close to you in this space which you have helped people? You don't need to name anyone, so that would be best to get it home, right?
The stories are powerful. So I mentioned there was no data until July of 2016 is when the Centers for Disease Control and Prevention released data. I've been working on this thanks to that mentor, Bob Vandepaul, who helped me. When I moved to Washington State in 2014, my family stayed in Minnesota for a year so the kids could finish that school year. I didn't realize that I would lose a friend to suicide in that time frame. I'd been bold, but I'd been conservative. It's a weird mix of words, but I always waited for people to be ready to talk about suicide. In some ways, I was afraid to use the S word at work. As soon as I did use the S word, people said, "Oh my gosh, I had no idea. How could I help you?" The S word was suicide. I was being conservative because when I worked in the insurance industry, they didn't want me to make people nervous. They didn't want me to freak people out. But when I lost my friend Jeff to suicide in 2015, I literally declared war on suicide. I developed that 5-step strategy because I said, if we're going to lose good people, I needed to be bolder and I shouldn't have been so conservative. So literally, I declared war on suicide. It took me about 60 days to develop that 5-tiered strategy. But in that process, I learned this is life and death. And if I'm not going to be bold enough to do it, no one else was going to be. So I wanted to empower people. And I think that's the biggest takeaway. I never felt guilt losing Jeff. His family thanks me for the great support and years of quality that I was able to bring him as a leader. But they did say to me, if you ever have a chance, Cal, to use your voice louder, do it so a family like ours. And they included me in their family. And I've never forgotten that I represent Jeff, AKA the big dog, every day in the work that I do. And it's powerful that I don't feel guilt because he knew I loved him. He knew I cared about him. He knew I asked if he'd considered self-harm, including was he thinking of suicide? But what I recognized was we needed more urgency. We couldn't wait for the systems to take care of it. We needed to build real-time, peer-to-peer support. We needed people on every job site to be the safety net to keep people like Jeff slipping through the cracks. So that's one of many stories. And
that's very powerful.
I think of him every day. He still died and nothing will bring him back. And even after a couple of years of waging war, my mentor Bob said, you realize nothing will bring him back. Yes. But until I know that I've avenged his loss, I'm not going to ease up. And I really haven't. But I've leaned in on this army of helpers and recognized together we're doing more than what any one of us could do alone.
Love it. I want to go back to the actual root cause of it, right? We've mentioned the substance abuse, opioids, everything along alcohol, and leads to suicide at times. What is the reason that people, employees or workers, go, first of all, to these levels? What's the root cause of that? Because we need to understand that, right, at this level.
Yeah. And what I appreciate about you and your wisdom as a leader and a coach and a mentor, you recognize there's no easy button. This takes hard work. The root causes are complex. There's no one single cause. It's pathways that create this intersection in this maze of challenges. Some days I have regrets that we had to tie suicide prevention to mental health to get people to write about it. Over time, we've learned sometimes it's a lack of emotional regulation, a lack of human connection. It could be a substance use challenge. So there are so many pathways, but I think this is hard, demanding work. The pressures of today's construction are very challenging. Schedules have been compressed. We have a worker shortage. There's scheduled and unscheduled overtime to meet the demands of schedule. We have musculoskeletal injuries, which was a pathway to opioids, but pain from acute injuries or chronic injuries disrupts sleep. Fatigue is a huge factor. There's evidence that shows people working over 50 hours a week have declining productivity and then increasing anxiety, increasing work pressures. It creates and spills over into our home lives. Some of it's been regrets that I miss opportunities with my family. I did a training class yesterday for an international union at their training center, and the workers were describing, don't forget about our long commutes. I'd mentioned about 15 risk factors, but a number of them said, don't forget about our long commutes. I think sometimes people not in construction think workers just show up to a job site like they do, but our workplace changes. And then we have harsh weather conditions, everything from wet to extreme heat, to desert conditions, to you name it. I think our workplace would require a lot of ergonomic interventions, but we worry about how slow that will make us and impacts our productivity. And we're trying to say, let's redesign job site culture. Let's be supportive. Let's see the person. Let's meet them where they're at. And if someone is struggling, let's make it possible to talk about it. So no easy button, a lot of risk factors. What it starts with, though, is recognizing we're all human. We need to acknowledge it's okay to not be okay and to give people multiple outlets to get support.
Got it. And this is important, right? When you said the big construction companies, they have their management, they have a duty to the shareholders. So the pressure keeps falling onto the employees to deliver something. How important is it at that level, the management being aware and being trained at their level to then go ahead and actually say, okay, fine, there is this issue, there is this problem, but how to be more human in conveying that and being more, I would say, not 50 hours, but 40 hours. I mean, it's kind of work-life balance at the end of the day. How is that journey in educating the management or the C-suite?
Yeah. Again, I'm really proud of how our industry has responded. And it's going to take time to make those shifts. But leading companies are embracing in this idea of human capital risk management. There's so many positive things, so many examples that are working. But what really makes a difference is when leaders are able to recognize the complexity of the work and then to make changes in workplace culture. So this is cutting across a lot of different pathways, and we're making progress. It's slow but steady, and that's usually what wins the race. Not a fad, not a quick fix, but systemic change at the company level to drive it at the crew level.
Got it. It'd be good to get that list.
And I'll also share some of the hotlines that do exist so people know that there is social service support to mental health and crisis response organizations. So I'll share that for some of the most popular countries, and I'll put a few links so people could find additional pathways to help.
Excellent.
Thank you for doing that.
Anytime. It makes a difference. And if someone is actually worried about a coworker, friend, or employee, what are the immediate practical steps that they can take?
Yeah, if you see a distinct change in a friend or a family member or a coworker's demeanor and disposition, and you're worried about them, please lean in, have a private conversation. Let them know that you care about them, that you're concerned about them. One of the links I'll give you is it's a message called Seize the Awkward. Learn icebreaker conversations to initiate those conversations, to let people know, I care too much about you to not say something. So recognize it's going to be awkward the first time you have that conversation, but it gets increasingly easier the more times you do it. But they have a 5-step safety conversation called Learn Saves Lives. And each step in that 5-step model is how you can have a safety conversation that's personalized, effective, and refers people to care. So some of the resources that you're willing to post with this episode, I think will be helpful for individuals. And maybe we'll crowdsource a list of people listening from other countries who are like, hey, we have Samaritans here, this program. Hopefully we'll build that type of support to give your listeners additional resources.
Yeah, that would be great.
Yeah, definitely warning signs. They're going to manifest differently based on people's personality. So sometimes you see polar opposites. So you could see a quiet person suddenly becoming very enraged. You could see irritability. If a person who's normally very emotional and very expressive becomes withdrawn and isolated. So sometimes they manifest as the polar opposite. But I would say when you see people being increasingly withdrawn, separating, not being part of a cause, separating from family activities, not participating in work activities if they've previously done so, that's an example of a warning sign.
That's important. Yeah, this is the other question which I wanted to ask you. What makes these initiatives successful, and what can we learn from them globally?
Yeah, I think what's powerful, they're culturally relevant to the audience that they're serving. So they're homegrown, they're organic, they are built from within that industry, and they offer outreach to others. This idea of peer-to-peer support is what works very well. I heard yesterday an example of a father who's an instructor for a trade union. A child works in a different industry, and when that child experienced addiction, it was a peer-to-peer support that visited him in the hospital to check in. And that was the turning point where the family had tried to help. Doctors and therapists had tried to help. But it was the recognition of, wow, they cared enough to come and see me. And they offered no judgment, but they offered me support. I'll try this. I'm increasingly buoyed with optimism when I hear those stories. So many powerful stories of lived experience. So those are two of the unique qualities. And I think teaching people how to have those tough conversations and then equipping people. So educating, equipping, and empowering individuals, and then giving them an opportunity to get involved at the job site, to be part of a banner, to be part of that cause bigger than themselves. I think that's what makes those programs so successful.
Fantastic.
So I think we're becoming more similar than dissimilar, and we're learning from each other, and I think that's what's powerful.
Wow. And you're speaking about the United States, right? I think you said it has 5% of the population, but consumes about 80% of opioids. Why is this happening, and what needs to change?
There are so many risk factors here in the United States. It did start with a mass marketing campaign. There was this pattern of over-prescribing. Opioids were relatively inexpensive. They became abundantly popular. This has been very well chronicled in a series of documentaries. It's been popularized in literature. It's been written about in public health. It would be the pharmaceutical crisis in our country. Sadly, it got so out of control that the government regulations stepped in and shut down doctor shopping and pill mills that were available for mass prescription refilling. And those were prescription drug monitoring programs. People weren't given an opportunity to be transitioned. So when they had withdrawal, they got dope sick and needed to fill that need for opioids. The first drug of choice was heroin when those programs were instituted, and then synthetic opioids. And then just a whole perfect storm ensued. And when the pandemic hit, opioid overdose deaths almost doubled in a 5-year period. And it became a terrible human tragedy, and a lot of despair and destruction was created. We've had to learn that there are alternatives to opioid pain management, And we need to protect ourselves by asking doctors, surgeons, and dentists about alternatives, especially for anyone in recovery or with a family history of addiction. But learning that those are leading gateways, injuries both on and off the job, and then medical, dental, surgical procedures, and then leftover pills. I was fortunate many years ago to meet a group in the United States called Goldfinch Health. Their core business exists to optimize surgical outcomes. We have to learn about non-pharmacological pain, not just pharmacological pain, and to learn how to heal, and that surgery with fewer opioids is possible. That organization, the co-founders taught me that on average, people only used 27% of the pain medicine that they were prescribed. So if we could reduce the initial dosage by requesting fewer pills, we would have fewer pills left over. That organization taught me where in the literature, medical literature, 90% of people didn't properly dispose of leftover medication. That became a leading gateway as well for teens and preteens, young adults, guests in our home. So how to use safe disposal of leftover medication. Don't save it for the rainy day. Took some behavioral changes. So pharmacy chains had drug take-back kiosks. Federal and state and local government had drug take-back days.
Right.
But we also could use drug deactivation products for safe disposal at home. It takes a lot of strategies. There's no single solution. But this opioid topic is one that I knew from my childhood and my teenage years. It was something I felt uniquely qualified that I could teach people first dose prevention strategies to educate people about those alternatives. And they're always amazed, like, wow, there are alternatives to opioids? Yes. Other countries use over-the-counter, non-prescription medication for pain management. Opioids serve a purpose, but maybe they should be a last choice, not the first choice in the States.
Yeah, that's a massive change, right?
It's a massive change. It takes time to change the medical system, but it requires each family member to know how do we protect ourselves and our families.
Yep.
So thank you for letting me shine some light on that important topic.
Yep. What does mental fitness mean to you? And how can someone begin building theirs today, especially going through this journey?
Yeah, it's so exciting to see this idea of mental fitness come of age as well. 20 years ago, if we had talked about mental fitness, resilience, mindfulness, people would have probably laughed and chuckled, and there would have been no application for it. Sadly, it did take a crisis of mental health and suicide for us to shift this around mental fitness. So there is a need for every person to understand their emotions and learn how to control and regulate those emotions, and then learn the intersection of physical health and emotional health and well-being. This idea of mental fitness ties to resilience, bending but not breaking, and getting stronger and understanding the effects of adversity, not letting it become traumatic, but learning how to diffuse it. But mental fitness goes beyond this idea of being mindful and taking care of body, mind, spirit, or soul. Different persons of different spiritual walks might have a different term for it, but I tried to be inclusive there. I think it's powerful when you see organizations now teaching these ideas of resilience and teaching people team problem solving, peer support, so people aren't isolated and alone. A lot of what I see on the mental fitness is still being taught outside of the workplace, outside of the job site. And it's people getting coaches and working intentionally on the idea of mental fitness. And that's one of the things I think that drew me to you is your work in leadership and development, teaching people some of these techniques and strategies. And I think you'd be very effective at that. And I'm grateful that we've had these opportunities to talk about the importance of mental fitness. It's still on the horizon, and it will become increasingly important. I think as leaders recognize how important mental fitness is, entrepreneurs face a tremendous amount of stress, and having the opportunity to learn not to be perfect, but to accept imperfection and then grow through those experiences. There's so many pathways to helping people through mental fitness, resilience, mindfulness going forward. I can tell you're going to be very effective and passionate about that.
Oh, yes, definitely. Yeah. What's a personal ritual you follow for your own emotional well-being? A walk, a quote, or a song? Any one of those?
I use a lot of music to watch hockey. I'm a big hockey fan, and I do love soccer. I don't find the timing of soccer as convenient as I used to, so I enjoy hiking. I
Right.
live in a community that has a 50-acre arboretum, and I just find a lot of satisfaction being on the walking trails and being in the trees. It gives me this sense of connectedness when I'm alone. I don't feel alone. I'm with those big, tall trees. It's one of the things we love about being in Washington State, a lot of nature and taking access. Even though it rains a lot, there's something calming about that soothing rain.
Love it. Cal, it's great having you out here. Thank you very much. That's a wrap for this pod. Thank you.
Thank you so much.